colleagues, guests. Thank you very much. I would like to start with a quote. Thomas Edison. He said that 100 years ago. The doctor of the future will give no medicine, but will instruct his patients in care of the human frame, in diet, and in the cause and prevention of disease. And that's, I think, exactly what we're here for. He said that 100 years ago, and I think at that time he was very visionary. Structure dictates function. I do health classes for my patients before they have their first exam. And I have architects and engineers in my health class. And when I tell them, and I ask them, can you relate this to anything you do in your professional life? And they say yes. If a structure of a building or of an object is not correct, this will ultimately alter the function of an object or of a building. So they easily get it. Do you know what this is? It's a foot. It's a foot of an animal. Look at the funny lines on the toe. And those funny lines have a function. By the way, this is a gecko. Gecko is this little animal on the left. His foot has thin lines, and if we analyze those thin lines consist of small hairs, and if the gecko puts pressure on the foot, that will cause an adhesion, so the gecko can walk on a wall or anywhere he wants. If you alter the hair structure on his foot, this will ultimately alter also the way he walks. Let's look at human beings. Let's look at the spine. Why does the spine have 3 curves? This is the lateral view of the human spine. There's a reason for that. Why? We do not walk on 4 feet anymore. We're biped, we walk on 2 feet, and because there's gravitation, we have to compensate for all the weight that comes from above and pushes down. So we need to have 3 curves to compensate for all the pressure that comes from above, okay? And if we alter this structure, which is extremely valuable, we alter the function of a human body, okay? Like the spring. If we alter the structure of the spring, it cannot function as a spring anymore. And technology use, so handheld devices and everything, ultimately change this structure. I'm going to talk about technology-related health problems first, then I'm going to point out a couple studies, try to come up with solutions, and I will do some final remarks. Technology neck. We look at our devices 4 to 8 hours per day. In 2013, 1.91 trillion messages were sent only in the US. Let's look at the head weight. In 60 degrees head angle, so forward posture, we have a load of 60 pounds. 60 pounds is 27 kilos. 27 kilos is equal to a 3-year-old child. So you can put the 3-year-old child here on your head and carry that child around. That's the same weight, okay? Now, what are the consequences of forward head posture? If we look at literature, if you look at press, if you listen to people or to doctors, the most thing we hear about forward head posture and its effects are pain. But pain is not the only thing we need to worry about. There's much more than that. We've got depression, we've got digestive problems, We've got decreased libido, we've got restricted breathing, cardiovascular problems, okay? And we're sitting on a ticking time bomb, and people are not aware of it. I have a patient, she is 12 years old, she has a military neck, she has a straight neck, she lost her curvature of her cervical spine, and she has thyroid problems. Why? Because nerves coming from the cervical spine supply the thyroid organ. And she's on thyroid drug. So she's 12 years old now, and let's say she has a lifetime expectancy of 80 years, she needs to take that drug. Why? Because the spine and the function are altered, okay? Let's look at a couple studies. Lung capacity can be reduced by forward head posture by 30%, okay? Let's look at blood pressure. The tone of the cervical musculature can alter blood pressure. Asthma is a big issue. And if you have good posture, you can have a reduction of asthma-related symptoms. Correct posture can alter fatigue and improve your mental status. And 70% of the population suffering from headaches demonstrates cervical dysfunction. This is very important, especially in Turkey, because in Turkey, everyone thinks that spinal problems or any symptoms are always related to a herniation, to a disc herniation, but that's not true. A herniated disc is a finding on MRI, but doesn't explain the cause of the problem. Thoracic kyphosis can lead to early mortality. Okay? Height loss, they showed that men who had a loss of 3 centimeters in their height were 64% more likely to die of a heart attack, and those who took care of their spine had a longer lifetime. Again, hyperkyphosis, so a spine like this can predict mortality in women. And there are lots of people like that I see in my office. After 40, 50 years of age, they walk around like this, and they have no clue. They're sitting on a time bomb. Power posture. How can a posture alter hormones? It can elevate testosterone, it can decrease cortisol, and you can have increased feelings of power and a tolerance for risk. It even influences mental perception. It impacts persuasion by affecting direction of thoughts from negative to positive. Worker compensation. Companies who invest in ergonomics and the teaching of ergonomics and change tables, chairs for their co-workers make a big investment. For example, Facebook in Palo Alto in California, they do that. They even have a chiropractic office there, a clinic with 4 chiropractors taking care of 2,500 co-workers. And that's why they increase the productivity. I've seen lots of companies here in Turkey. We taught them about ergonomics and what they do wrong, and even the ones who are very into innovation, they do not see the link between ergonomics, how you sit in front of your laptop, and how this can alter your productivity. So back, structure dictates function. Okay, so what is the solution? 1, prevention. 2, correction of spinal structures. But unfortunately, for prevention, the time gets smaller and smaller, and the time starts at the age of 3. You see kids walking around with iPads, looking down, and parents are okay. So you need to teach them how to use it and maybe limit the time they use it. But what we need to do more is the correction of spinal structures so those people are healthy in future, now and in future. So what can you do? You can move more, because sitting creates a problem in your abdominal area, because if you have weak muscles, your torso cannot be stabilized. So you need to get up and walk more. And people who sit for 10, 11, 12 hours, they look like this after some year. That's the posture. That's the posture I see of kids, 10, 11, 12 years old, not grown-ups. In 10 years, they're going to be worse than us. You need to lift your phone. So even doing this all day is better than, this or even further down. And you need to keep your core engaged. Squat is a very good exercise to engage your core musculature, to stabilize it. What can you do to correct spinal curves? 62%, 64% of all spinal manipulations are done by chiropractors. Chiropractic is a science that takes care of subluxations in the spine, which then alters the spinal structure over time. And I've got a couple examples here. You've got a military neck, a straight neck of a patient here, and it should be more curved. And after 2 years, we have a curvature like this. So normal structure, and because that patient got a normal structure, function altered, and the problems dissolved. Here's another one. This was an architect, 25 years old, came with an awful posture. This is a lateral view, and after 9 months, he stood up straight, and now he's doing his military service in Turkey. So, my final remarks. Good posture is an absolute must, no question. Second thing, educate, 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 It is our responsibility, and you need to have a multidisciplinary approach, so you need to work together with people who take care of addiction, posture, and spinal structure, So this is our moral obligation. Thank you very much.